So what is congruency review?
So when you think about the clinical trial agreement activation pathway, there's several steps, right? You have the CDA that's signed at the beginning, and then the study team gets to review the protocol and all the feasibility goals. And then once the study is greenlit, that's really where the congruency review component comes in, because the first step is going to be a Medicare coverage analysis where you're determining what's, research and will get billed to the sponsor and what will get billed to the insurance. That Medicare coverage analysis then delves into the building of your calendar, your schedule of events in your clinical trial management system, right? That then goes into budget negotiations. And then once those budget negotiations are complete in that clinical trial management system calendar, you do your financial console overlay, your financial console bill. In addition to that, you have the contract that is being negotiated, and you have the informed consent that is being negotiated. And generally, this process can be broken up into several different specialities, meaning, there could be multiple different groups at the institution doing this. There could be multiple internal groups at the institution and multiple vendors involved in providing all of these services. And in the end, once you come to that finish line, all of this stuff needs to align. The Medicare coverage analysis needs to align with the calendar, which needs to align with the budget, and then the contract needs to align with the informed consent form. And so at the conclusion of all these processes, ideally, somebody is doing the vetting that all these documents align. And frankly, this is a really big gap in the industry on both the site side and the pharmaceutical side. It doesn't appear that there is much congruency review being done on the pharmaceutical side either, because a lot of the times you find yourself in these situations where you're talking to their regulatory folks about what the ICF says, and you're talking to their legal about what the contract says, and they're saying that they should say two different things, and you have to say, well, you two need to be on the same page in terms of what this needs to say, because they need to align. And with the budget coverage analysis and clinical trial management system stuff, right, a lot of the times there's nobody who does that final congruency review at the end, and everybody just relies on hoping that everybody did their job correctly throughout the process.
Contact us at darshan@kulkarnilawfirm.com.